Happy Friday. We're doing our Wednesday health segment a little bit later this week. We're talking about the health headlines. And as always, we are joined by Dr. Syed Hussain of Trinity Health of New England. Great to have you back. Thanks so much for being with us.
Thank you for having me.
All right, so we're talking about some new numbers, delayed screenings for cancer. What does this mean? Because earlier in the week, we did have some good news when it comes to cancer numbers, but this is not as great, right?
Right. So let me start with the good news first, so viewers are aware. So all in all, we expected a little bit of a bump due to the pandemic because of missed cancer screenings and late cancer diagnoses that we saw in 2020, Erica, but that has not materialized. So we continue to see a downward trend, which is great news in terms of cancer mortality. However, within that data set that this large study that just got released indicates is what we've been talking about on this show for the last several months is a concerning upward trend in cancer diagnosis in younger adults and in women under the age of 50. Now, it's multifactorial. It could be lifestyle. It could be early screening. And we've spoken about lifestyle, how this may be impacting certain cancers, and we are seeing a rise in younger adults. So that's the concerning portion. The good news, though, remains that all in all, year over year, cancer mortality or death from cancer is decreasing, and we did not see a bump during the pandemic. Even though we saw a blip in 2020 with folks getting diagnosed at a later stage of cancer because they missed screenings, a lot going on in 2020, obviously, as we all remember. But that went back in 2021 where it was pre-pandemic level data.
All right, so there's also another report we're going to talk about here, that brisk walking may reduce your risk of abnormal heart rhythms. Tell us a little bit more about that.
Yeah, this is an interesting study. It's about around 500,000 individuals from the UK. And basically it looked at pace of walking, slow, average, and brisk. And what correlation does it have with the with formation of arrhythmias, onset of arrhythmias, which is an abnormal heart rhythm? It could be either fast or slow. And what it basically found was average or brisk walking is associated with less development of arrhythmias. And what I want to tie this back into is heart health. Exercise and heart health have a strong correlation together. So it's important that you have some sort of exercise regimen, especially if you have underlying medical problems, if you have high blood pressure or diabetes or obesity. We know this moderate exercise regimen over a course of the week will be beneficial in terms of heart health.
Right. So if you're not doing anything, just get out there and take a little bit of a walk.
Absolutely. And it's great weather now, too.
Yeah, anything is better than nothing.
That's right.
Well, as the weather is warming up, of course, we're going to be spending more time outside. So we want to just kind of a refresher on sun protection, how much we need, what is enough, and if there's like a maximum. Because I know I've had a question of if there's 50 out there, if there's 60 SPF, is it the same as like doubling up with 2 applications of the 15? Great
question. So SPF of 30 is what the American College of Dermatology recommends. So that's enough to confer protection from the sun's harmful rays, ultraviolet A and ultraviolet B rays that can cause sunburn, skin aging, wrinkle formation over a period of time. But most importantly, ominously, all of these rays can lead to skin cancer, all types of skin cancer, especially melanoma, which is arguably one of the most aggressive and dangerous forms of skin cancer. So it's important that you apply sunscreen if you're, and it's water-resistant sunscreen is better. Use shade. Try to avoid the sun if you can from 10 to 4. That's when the sun's rays are the most harmful. Wear clothing that is protective, so long sleeve shirts, for instance, or trousers if you can. But those common sense things are important as we head into summer.
Yeah, one more question on that, because I always get confused. There's SPF 2, 3, 15, 30, 60. Is 60 that much more protection over than 30 or 45?
Great question.
I don't know if it's an actual difference or if it's just more.
It's a very small incremental increase once you get over that period. So that's why I said 30 is best, and apply or reapply every 2 hours, 2 to 3 hours.
Right.
And more frequently if you're going into the pool or if you're getting wet.
Obviously, it's going to wash off.
Yes, and that's why water resistant also helps to some extent, but SPF 30 or higher.
Yeah, just put it on. All right. Dr. Hussain, thanks so much. Appreciate it. Good reminders as we head into the warmer weather for sure.